Well, hello and welcome to episode 31 of the Money Talks. And today we've got a very special episode. I think we're doing this for the first time. We actually have our first cross border entrepreneur on the show. We've got Shelley Saxena of Sevamob and who's joining us from Georgia. Hey, Shelley, how are you?
Hi, Narut. Thanks for having me on the show.
This is good morning to you right now, or is it? I would imagine very early morning for you.
It's almost noon time here, 11:30 a.m.
Oh,
in the morning.
11:30. Okay,
Yeah.
I think I've got my my time zones incorrect. But thank you so much for joining us. I know we've had difficulty just coordinating on the time simply because of the time zones and the fact that you're so busy. But considering you're running a venture in India, I would imagine you get very little sleep at what people would call normal times.
No, it works out well because I get up early in the morning. That way, I'm able to catch most of the people in India, and that way, also able to start my day quite early. So gives a
Great.
lot of
So what
time.
we're going to do today is, Shelley, hopefully take you, to, hope because you've got a very interesting journey. IIT Roorkee, Cornell, IBM, then SaaS Mob, and then Sevamob, and your funding journey over here, and how you're running this business. So I know there's a lot of content for me to cover. Hopefully, I'll be able to get through all of it. But what we're going to do now is I'd like to really talk to you a little bit about your journey with Sevamob. What does Sevamob do? And then we can get into the story behind why Sevamob was started. So maybe for the audience, what does Sevamob do?
Sure. So Sevamob is a US-based company with a subsidiary in India. We also have franchises in Southern Africa, and we provide an AI-enabled primary healthcare platform to organizations. The platform has two components. One is AI-based triage and point-of-care screening for blood, vision, urine, diet, and sputum. And second is health outcome delivery via telehealth and asset-light pop-up clinics. And by integrating these two components, we're able to enable delivery of primary care at up to 50% lower cost. For us, it's a B2B model. Our customers are employers, NGOs, hospitals, health insurance companies, pharmaceuticals, and local government agencies. And currently, we are serving more than 100 B2B customers in 15 plus states of India and one state of the US. And we've also done pilots in South Africa with customers like Nelson Mandela Children's Fund, Barclays, CSR, and so on.
Very interesting. And like I said, I don't want to get into too much detail into that right now because we're going to do that a little bit later during our conversation. But Shelley, you are obviously you weren't born in the US. You grew up in Lucknow, and uh, and from there but did you always want to be an entrepreneur? I mean, you Lucknow is probably not known for entrepreneurship as much as other towns of India.
Yeah, my schooling is from Lucknow. Then I did my bachelor's from IIT Roorkee in electronics and communication. And after that, I worked at IBM for 1 year in product development. And then I did MBA from Cornell. And then I did product management channels and go-to-market work at IBM. So the way I stumbled into entrepreneurship was that IBM had a very buttoned-up culture, and there were lots of ideas buzzing in the head, which I could not implement fast enough with the bureaucracy at IBM. So that's how I co-founded my first company, SaaSmob, where we could like do something with cloud-based mobile platform technology, which I initially tried to attempt at IBM, but because of the all of the paperwork there, it could not happen. And so we were able to secure a number of customers, and that business has been profitable for a while now. And I'm an advisory role over there now. But that was the initial impetus. Just too many ideas buzzing in the head, and no outlet for those ideas at IBM.
But you were at IBM for 10 years, I
Yeah,
believe.
yeah,
And
almost.
what was that experience like? Like, IBM obviously was a bellwether at one point of the tech world. And a lot of companies have actually come out of IBM, right? And a lot of founders have come out of IBM. Um, and of course, I mean, starting out as a product manager over there, I think what was the DNA that you took away from working at IBM and probably applied that to your current role?
So I had great experience at IBM overall in terms of learning. Fresh out of Roorkee, I had very little practical skills. Like there was a lot of
Mm,
theoretical knowledge I had, right? One of the advantages of working at IBM was I was working with different product groups for like 2 or 3 years in product development, And so that broadened my technical skill set and gave me some background. I started with Lotus Notes very early on, and then did a bunch of stuff in Eclipse group, then with their portal software and mobile software. So that gave me a very pretty broad skill set. And the reason I came back to IBM is because they were processing my green card. And so I did a fast track program at Cornell. And after that, again, IBM gave me the opportunity to do product development, product management channels and go-to-market work. So I would say that I credit my business experience and my technical experience totally to IBM. And because they have so many different product groups, I was able to broaden my skill set quite a bit from there. The downside of the experience at IBM was that, again, it's a lot of bureaucracy. And so as if say you have a number of ideas and you want to get them implemented fast, it would take you a while to get somewhere. So that was the downside, but the upside was
why is that though? Why is it that, I mean, I've noticed this about most companies. As they get bigger, the speed of innovation keeps on coming down.
That's just because there are so many different gating factors before an idea gets to the product stage and is actually used by the customers. And each gate point has its own time, milestones and cycles and so on. So which extends the whole process. And then there are too many cooks in the kitchen. So that's another thing. The people if they're more experienced than you, then obviously they get the first say at how things should be done. Even if you are supporting your stuff with proper analysis and everything. And so I would say that's probably the main reason why at large corporates, innovation takes its own time.
But Shelley, it's very interesting that you decided to go to IBM. Obviously, in a way, because of your green card, you like you mentioned, you probably had to. But it's a very interesting question because we've had a lot of guests that either after they graduated, joined like an established brand like an HUL or a ENY, or even in your case IBM, and some people that directly went into entrepreneurship, right? But if you had to do it again, and let's imagine that the green card was not really the issue, would you actually want to work at an IBM for a couple of years before starting out as an entrepreneur? Or would you want to go straight away start up as an entrepreneur?
That's a great question. I would say that I missed out on the tech boom in 2000, around 98, 99, 2000, because of this fixation with working for a big brand. And then once the green card processing started, that further led to delay of what I could have done faster. But at the same time, I would say that definitely experience in a corporate, experience with customers, experience with technology, that what makes you a successful entrepreneur, right? So there are pros and cons of doing it too fast and waiting for a while and doing it then. I would say I probably delayed it a little because of green card. I should have done it a little bit earlier, but I definitely loved my initial work at IBM.
Yeah, I also believe that whenever we are evaluating startups, I think founders that have had a couple of years in a corporate, again, not a lot, but let's say if they've had a few years in a corporate, I've always felt that they're a little more settled because they understand process, right? They understand the results are not going to come from magic; they're going to come from process, and that because they've been part of such processes at a larger company, they have a tendency to create processes. I think that's at least my observation over the.
That's absolutely right, Anirudh. So for me also, with that experience at IBM, while there was a lot of bureaucracy there, it did give me that insight as to set up processes in my own company, right? Which if I was fresh out of college and starting, I would not have that experience. The second thing is, since in both my businesses, it was a B2B model. In a B2B model, especially if you're pitching to bigger customers, larger corporates, you have to have that understanding of the sales cycle. You have to understand who to pitch it to, how to progress that sales cycle, how to how to understand the pain point, how to talk in their language, right? If you're fresh out of
very true,
have that experience.
Very true. Yeah. And then what was the trigger that you decided, when you were done with IBM after 10 years, what was the trigger that made you want to now start Sevamob?
So I found some good co-founders who wanted to do something big separately from their jobs. And at the same time, as I mentioned, there was a bunch of things I wanted to do at IBM as part of the mobile portfolio that I was managing there. And I could not implement those things at IBM. So I decided to then take my ideas and then implement them myself. And it was a good learning experience. It took me a while because until that point, while I had the experience at IBM, I did not have the experience of running a P&L as a separate business and so on. So there were a bunch, especially as a smaller brand, it was very easy to get on a customer's calendar with IBM, but it was a lot more harder to get on say a potential client's calendar without that brand name behind you. And so that was a good learning experience, I would say. It took us a while, but all of those lessons worked out pretty nicely for us when I founded Sevamob.
And Sasmob was bootstrapped, I believe.
It was bootstrapped, yes. And we
4
pretty much
years.
did everything from customer revenue from the beginning.
Very interesting. And then what was, I guess, the biggest takeaway from the whole Sasmob journey that I think, or rather the trigger that would have taken you from Sasmob into Sevamob?
So the first takeaway from Sasmob was that at that time I was very enamored by technology, and it was technology looking for a solution or looking for a customer pain point, right? We did hit on the right pain points, and we did solve a bunch of problems, but it took us a while to get from a cool technology to a cool to a actually usable payable solution, right? When we were at Sevamob, from day one, we hit the ground running. We knew what the pain point was. We were able to pitch a solution for that pain point. And so I would say that was the big takeaway from Sasmob that translated into Sevamob. The initial impetus for Sevamob was an issue with my mom, where she was incorrectly diagnosed and almost lost her life because of hepatitis C.
Oh, wow.
And this happened in Lucknow. So the thinking was that if this could happen in a tier 2 town, which had pretty good medical services, what about tier 3 and rural? And so we started a primary healthcare service on a B2C model in 2 towns near Lucknow, Kakoli and Maliabad, which are in the Mango Belt. And very quickly we realized in the first year that a B2C model would not scale, especially in that setting where the payers had a limited paying capacity. We had hit the right pain point. We had the right solution, but where we went wrong was the business model of whether to do B2C or B2B. And so within a year, we switched to a B2B model, and that's what scaled for us. So initially, we were doing a general health service on a B2B model for employers. And very quickly, we realized that it was easier to charge the customers more if we did more specialized services and more treatments and procedures rather than just consults and prescriptions. And so over time, we added services for vision and dental and nutrition and cardio-metabolic and infectious disease, cancer, ENT, and more. And each one of those.
That's almost like a pop-up clinic.
Absolutely. So it was a pop-up clinic at that time, and we were able to increase our average revenue per patient by using this approach of instead of a general health service to a specialized service with both not just a consult and a screening, but also with a treatment option. So, for example, in case of vision, we were doing prescription glasses and eye drops along with other stuff, and then referring patients for surgery, cataract surgery, or so on. In case of, let's say, dental, we're doing on-site scaling and caries removal and filling. In case of, let's say, ENT, we're doing on-site consults and screening plus fitting the patients with hearing aids. So that treatment element of it made all the difference to the model. Then what we realized was that our customers sort of led us to the next milestone where they said, okay, your pop-up clinics are good, but we need something between the pop-up clinic visits because the pop-up clinics could not be there every single day, day in and day out. So we switched. We also added telehealth infrastructure back in 2017-18. And in telehealth, we added three options. One was just phone-based advice because a lot of customers we serve in underserved rural, they cannot really do video or web or things like that. And then also second opinions and video consults as part of the platform. And then around a year and a half to 2 years ago, there was a big learning experience for us that there were around 15% of our consults are in malnutrition. Because as you might be aware that in underserved populations, roughly 40% of the women are malnourished in India, whether low BMI or anemia or whatever it might be. So 15% of our consults were nutrition related, but it was very hard to find dietitians, especially standard dietitians who could serve not just in urban and rural. And when we could find dietitians, the cost of the dietitians was pretty high. So we developed our first module, Diet AI, which could be used by a nurse or a health worker. And we did this with this went hand in hand with supplements and behavioral counseling and telehealth capabilities. So that was our first solution. We did a study with Medtronic in 3 states of India. Our anchor tenants in that study were Vedanta in Jharkhand, SOS Children's Village in Delhi NCR, and Fullerton in Rajasthan. And in that study, in a 1-year study, we were able to improve malnutrition and BMI for 13% of the adult population in 1-year time period. And the diet AI was 96% accurate when it was evaluated by a panel of dietitians. So that was the initial impetus. And we were able to reduce the cost 67% by using a nurse with our diet AI instead of using a dietitian. So we saw the results there. Then we applied the next module, which was blood AI. The initial impetus for that was RFP from government of Maharashtra, where this was point of care diagnostics for primary healthcare centers. But the turnaround time requirement for things like RBC counts and WBC counts was 2 hours. Now, if you are familiar with that, which I'm sure you are, Anirudh, that every single primary healthcare center, you cannot take a sample from there, go to a lab and bring it, do the results in 2 hours turnaround time. It's just not possible.
It's not possible. Yeah, absolutely.
Yeah. So in that case, we decided to use AI. We developed a module which could do RBC and WBC counts at point of care in a low resource setting. And so that's how we got into blood AI. And then over time, we added support for screening for iron deficiency anemia, because that's sort of tied with our diet AI also, right? The next thing for us was vision AI. So roughly 20% of our consults are in vision. And again, there the ophthalmologists are pretty expensive to deploy in the last mile setting. It can easily cost you 3,000 to 4,000 rupees per day per ophthalmologist. And so we developed a vision AI which could screen for diabetic retinopathy and cataract, can be used by a technician, does not require an ophthalmologist. And obviously the recommendations of the AI are then acted upon by the specialist, right? Then you are familiar with the government mission in India of 2025 TB eradication, right?
Yeah.
So, but the biggest pain point in TB is a good screening solution. So the current technology, the molecular DNA testing, that is very good for confirmatory, but the pricing of that is around 600 to 800 rupees per test, or even more in several areas. So you cannot really deploy it large scale for screening. Now, the Government of India protocol is that anytime a patient shows up in a primary healthcare center with more than 2 weeks of cough, then they have to do the sputum test. Now, just to explain to you how, I would say complicated that is, the technician has to manually take the sample, put it on a slide, stain and dry that slide, then look at it under simple microscope, analyze 100 different fields of that slide in order to rule out whether the patient is does not have tuberculosis, right? There are so many points where error can happen in this process. So we developed a solution which could automate this entire process, right from the point of actually staining it to the point of actually analyzing it, and then having that analysis further acted upon by a remote physician. So that's how one customer after another led us to these different modules, and that's where we are today.
But it's very interesting, Shelley. I mean, there's just so many different products. You could say you've developed so many different services, and you're doing them all at the same time, right? How do you allocate what should first of all, how did you decide what are the first 5 or 6 specialty services I'm going to have in my multi-specialty clinic? How did you decide that?
So we were lucky to have some very good customers, and I think that was a lesson from Sevamob. And that Sevamob, we first developed the solutions, and then we tried to find a customer. Here we had ready-made customers, a good pipeline, and the customer said, no, we need this. And then we tried to build that, right, and deploy that. So that's, I would say, the biggest difference between the two companies, and that's what's helped us do the stuff so quickly, and where for each module we have a pretty good solid pipeline. But I would say it's not like we are doing 10 different products. We have a single product, which is AI-based primary healthcare platform. Now, certain customers are only interested in that last mile health outcome delivery capability. Certain customers are interested along with that with telehealth. And certain customers want more diagnostics beyond what is available off the shelf in the market, right? And certain customers have more requirements around, let's say, reducing the total cost of solution and down to that to a level which they are comfortable with. So as a business, we have to provide a complete solution. Our lesson was that we cannot just sell technology and then expect that somebody would figure out the whole solution. In India or any developing country, the customers are not looking at technology. They're looking at a pain point and how best that pain point can be addressed by a solution. So that's the approach that we have taken in our business so far.
Very interesting. Very interesting. And all these technologies are they ipable? Are they something that
Yeah, so we have filed 4 patents on this. We've also filed some trademarks on our platform, and we have published papers. So our Diet AI falls under FDA Class 1 device. We have done appropriate, I mentioned the study to you, we published that in a journal, and we have deployed this in multiple customers. And then our blood, vision, urine, and sputum AI fall under FDA Class 2 devices. We have done phase 1 and phase 2 testing, published results. We have received Government of India approval for use as a screening device, and we have started double-blind phase 3 clinical trials in Lucknow. And the intent is to file for FDA 510(k) notification in summer of this year, so that we can sell this more broadly.
And who would be your usual customers? Like, who are in your current pool? I know NGOs and certain corporates are there, but what's your usual average customer like? And what is their?
So largest chunk of our customers are employers, and there at employer, it's either an employee health scenario and or a corporate CSR scenario, right? And typically the pain point which they're looking at is they want a single throat to choke for tier 1, tier 2, tier 3, and rural. While we provide service in tier 1 and tier 2, where we really differentiate ourselves even against big guys like Wockhardt and Apollo Hospitals, is in tier 3 and rural, where we have one of the best coverages currently in India in 15 plus states. We pretty much cover every state except east of Assam. Our last state on the northeastern side is eastern side is Assam. And tier 3 rural is where we have the best coverage, one of the best coverages currently. So that's the initial impetus for many of these customers, whether they are pharmaceutical companies or health insurance companies or employers or NGOs or local government
But do
agencies.
these people have to, do these employers have to deploy specialized people of their own, or do you provide those people as well?
We provide the full solution. So in most of the cases, the solution goes and the technology goes hand in hand with the health outcome delivery. And they don't care what technology we use, whether it's our proprietary technology or something else, right? For example, in case of Indian Oil, their motivation is to reduce the accident rates for their drivers. Now, that's all they want, right? Now, it's up to us to figure out which technology to use, how best to reduce the cost. Should I deploy an ophthalmologist in a given area? Can I even find an ophthalmologist in a given area? Or should I use optometrists with nurses and our AI, right? All that is our decision. They have their budgets. They have their objectives, and they measure us based upon the metrics.
Very okay, huh? And so currently, you said you have over 100 B2B installations at this point.
Yes.
And how many people does these 100 installation service currently?
No, so we have more than 100 B2B customers. In terms of installations, our installations are more than 225 to 230 installations at this point across India, where at each point we either have a dedicated team or we have a mix of dedicated or contract-based staff, depending upon how many working days we have in a given area. And then many of these, some of the customers are just pure technology licensees, and others are using a mix of technology licensing as well as health outcome delivery.
Interesting. And how do you? What are the price ranges? How much does it cost for a corporate to set up a clinic?
Sure. So if say it's the complete health outcome delivery, our price points start from 10,000 rupees per day for up to 75 patients, which includes consult, basic diagnostics, and meds as part of that, generic meds as part of that. And then the price goes up from there. So if, for example, vision, then the price is a little bit more. If it's additionally let's say cardio-metabolic, a little bit more. If it's dental or whatever, the price varies from there. But the entry point is generally 10,000 rupees for up to 75 patients, everything included in that. And then if it's a pure play,
and 10,000 rupees a month
per day for up to 75 patients, yeah. And then if it is a software only deal, there the pricing starts from 5,000 rupees per clinic per month, which includes patient data management, analytics, telehealth infrastructure. If it is additionally video consults on top of that, and that is another additional 10 rupees to 20 rupees per consult. And then the AI modules are built up from that point. So each AI module has additional pricing on top of that. But the starting point is
So
generally
essentially,
5,000.
do you think of yourself as a platform, a service provider, or a product company?
So far, we have been a technology-enabled services business where this platform can do. It's a hybrid platform, right? And but going forward in the next 3 years, our roadmap is to turn it from a technology-enabled services business to a technology-led business, and we are doing appropriate transformations in the company at various levels for that to happen.
It's a very interesting question from Rohit Nagpal. I'll just take it up. He says, what is the percentage of accuracy of the AI-based healthcare tests? And maybe you could also talk about, because there are all these different tests you're doing, right? So maybe
exactly
from that aspect.
So the accuracy depends upon the module. So our diet AI is 96% accurate as evaluated by a panel of dietitians. Our sputum AI is 81% accurate, and I can get into sensitivity and specificity. But if you look up, we have published our journal papers on this, and so you can get into exact specificity and sensitivity on that. But 81% is our accuracy on the sputum AI for tuberculosis. Then on blood, if it comes to RBC and WBC counts, our accuracy is around 80% on the cell counts. And if it is, let's say, iron deficiency anemia, the accuracy is more into 88% to 90% range. If it is urine, the accuracy generally varies from 85 to 92%, depending upon which medical conditions we're talking about. For diabetic retinopathy, the accuracy is around 90 to 95%. So it depends.
Actually, how does that compare to maybe what would be available in a city, like just as a means of comparison?
So we position this as a screening technology. So if say you were, let's talk about tuberculosis, for example. If say you were looking at molecular testing, whether it's TrueNat or something else, then that is almost 98 to 99% accurate, right? But that is a confirmatory test. It cannot be done at scale. And so we typically benchmark this against, say, the same stuff being done by a technician, right? And so then getting to 81% accuracy where everything is tracked, everything is documented, it's actually pretty good accuracy for a screening technology. Yeah.
And then in case somebody has a much more serious condition, do you then refer them to the city or to a larger hospital? How does that work?
All of the above. So typically, if it's a primary, if the issue can be handled at primary healthcare, typically our health outcome delivery teams handle it themselves. If let's say it requires secondary care or tertiary care, that's when we refer them to the nearest hospital. Now, depending upon the area in which the care is delivered, the nearest hospital might be, let's say, nearest government hospital, which might be in a tier 3 area, right? Or if the service is being done in an urban slum or in a regular corporate, then it might be tier 1 to tier 2 hospital, right? So we have different contracts, different such escalation points, and different metrics on when something gets escalated.
And I mean, then I want to ask you the really critical question now. So you sit out of Georgia, and here you have all your clinics and all this plethora of customers coming in on a daily basis across 230 locations in India. How do you manage all of that?
So great question. So first of all, I have a very good management team, which is bulk of that is based in Lucknow in Uttar Pradesh, and they have been doing an excellent job of managing the business locally in India. But I myself spend a month every quarter in India, including during COVID. So during COVID, I've so far done around 4 trips. And so that helps have feet on the ground, talk to customers.
What was the experience like cross-border during COVID?
Believe it or not, I actually liked it because the alternate seats in the planes are empty. The airports are semi-empty, and the ticket price actually, when I did my trip, I think in June timeframe, the ticket price for US India round trip was $640, right? For a regular ticket, which was like $1,300, right? So I would say it was a great time to travel. And since then, both sides of the governments have added more protocols. So now you have to get PCR test done when getting to India and also when getting back to the US now. So I would say overall it was not a bad experience after the initial stuff. But I would say also another thing which helped, just for everybody else who is listening out there, something which helps you actually have your parent entity in the US is that it is easier to move money in and out of the company. if because of the financial regulations, right? India does not have full convertibility. And so there are more restrictions in how the funds can be deployed. And also right now there are a lot of restrictions in, say, especially grant money. If some of you are trying to work in the non-profit space or even like social business, there's a lot of grant dollars available. But getting those grant dollars to Indian entity is a bigger question, just because of the rules and regulations right now, right? So I would say having a US entity or a US parent actually helps a lot from that perspective. Also, there's a lot of business development which can happen in the US, which cannot happen typically in an Indian scenario. So we did, for example, our pilots in Southern Africa. Now, to do that business development in India, even if you're in Mumbai or Delhi, is a very difficult proposition, right? But it's much easier in a situation like in, say, Atlanta in the US, right? It was also easier to get early stage money, at least for us in the impact space in the US market. At that point, there were fewer impact funders in the Indian market, especially as our funding needs grew and were more varied. So it definitely helped us. Were we held back? Just like everything, there's a trade-off, right? So there were several investors out of India who said they would want the parent company in India. And so obviously we could not go ahead with those investors, or they would not go ahead with us. And then this question kept coming up, that how are you managing something like this setting out of the US? And so far it's been it's worked out quite well for us. We have raised more money than some of our peers in the impact space in healthcare. And we have executed better than most of our peers in this space.
And Shelley, you started at a time when, I mean, healthcare was not sexy in India, right?
Yeah.
I mean, you've been in the space now coming on almost 5 years. And I know when you started, you had a lot of trouble raising money, maybe even convincing people, right? Because you were somebody sitting in the US, you've not really been in India for 10, 15 years. So how did you convince that first set of customers to even take your solution? Because, for them, it's still about 3 lakh rupees a month, right? That they have to commit to you for. So how did you get that first set of customers to back your technology?
Believe it or not, getting the customers was not the problem. But in a B2B, since you have invested in B2B companies, you might be aware that there's a sales cycle, there's the payment cycle involved, right? Oftentimes the payment cycle is 30 to 90 days. In our case, it is 30 to 90 days, depending on the type of the deal, the size of the customer, and so on. So getting that working capital for the payment cycle was a bigger headache than getting the customers. Because of the problem we were addressing, getting the customers was the easy part, right? But financing that was the difficult part. So let me talk about that, because again, that might be of
in fact, it's a very critical question. Many people don't realize that working with big companies, yes, you can do lots of billing, but there's a huge difference between what's billed revenue and what is booked revenue.
Yes.
Right. And until you have booked revenue, there's no way to pay expenses, and you're paying it out of your venture cap. So yeah, please, I would love to understand how that works.
Absolutely.
I mean, for the
Let's talk about some of the pain points of what are some of the roadblocks. So for example, only recently has invoice-based financing become available in India, or become more at least options are available now. Prior to that, at least prior to COVID, there were very few options for invoice-based financing, right? So and then if you go to the banks, yes, you can get good interest rates, but the first thing the bank would ask you is, do you have collateral? If you don't have collateral, then the size of the line of credit, or whatever you're trying to get from them, is pretty small, or totally absent. And I know that the government has said in India that they provide these collateral free loans through banks at for up to a limit of 1 CR through a startup
2 CR now.
Yeah, 2 CR now, right? Believe it or not, we have done the paper with several banks. When the rubber hits the road, it is really hard to get a collateral free loan. They say yes, there's a scheme. They say yes, they have a lot of non-performing NPAs, right, on their balance sheets. And so even though there is a scheme, they themselves would not make the collateral free loan. So end of the day, even after you get term sheets, and I'm talking about not just the public sector banks, I'm also talking about some of the well-known names in India on the private sector side, right, who are venture debt or other type of funds. Even they would initially say, okay, collateral free is fine. Yes, you have marquee customers, everything is good. But when they have to write that initial first check, it comes down to that, okay, we need some security here, or we need some guarantee here, right? And that's just a fact of life, and you just have to work with that.
But you also ran a business in the US, right? Sevamob. and I mean, I can talk from personal experience of running a business in the US and running one in India, but I would love to hear from your perspective, like how different has it been to run a business in the US, then come to India and then try to run a business in India? Like, what are the like maybe the three major differences that you find?
Well, the first thing is, so for example, let's talk about Sevamob example itself. So we were able to get a line of credit from Kiva for $50,000, no questions asked, right? And then we repaid the line of credit, obviously, from the follow-on funds. Then we were able to get, for example, from my bank, Wells Fargo, a line of credit for $40,000, no questions asked, no collateral,
Sure.
nothing. Emory University, same, they gave us line of credit, which you're not tapped so far, $40,000, right? So very easy to raise, let's say, line of credit or invoice-based financing. Then we got our initial seed investment from Village Capital. And they got redemption at the next round, which was led by ADAP Capital. And it was very easy to get that early investment, like not as much like, believe it or not, in 2014-15, I did try to get investment from a lot of impact investors in India. The cycles were really long, very tedious, very small checks. And so while you hear all these startups like getting million here, million there and stuff, in the impact space,
billions now.
Yeah. In the impact space, we talk about $50,000. We talk about $100,000. We talk about $250,000, right? And while a normal cycle, let's say for commercial investment in the AI space, can easily be a couple of $1 million at the DD cycle of, let's say, 3 months to 6 months. In case of impact space, you will spend 9 months to 12 months for $50,000 to $100,000, right? And even then, you don't know what's going to happen, even if you have everything lined up, all the right answers, all the right documents and everything. So that's just a fact of life. And so it was easier to raise money in the impact space from the US investors. I would say that was the biggest difference early on. Now I think there are more options available for impact investment in India. And also there was one lesson which we learned, which is to tweak our business model from a purely impact model to a model which was also attracted to commercial investors, right? And so we're still making that transformation. We're not completely there yet, but our last round was led by a regular commercial AI investor, early stage AI investor, AI Coin. And so I would say that's sort of helping us raise more funds.
I think it's very important at this point to also explain what impact investing is, because I've made some impact investments and a couple of them have actually gone on to do extremely well. One of them is almost a unicorn now. And it was, when I invested, I had no thoughts. I didn't even think it was going to become anything so massive as it has become, because I think they eventually went from impact to actually while they're creating impact for millions of workers across the world. It's a company called Tala out of the US, out of LA, in fact. But what I've realized is that they went, because they had a strong business case, they've also been able to attract, like you said, a whole plethora of investors besides just the impact investors itself. So for the benefit of some of the people that may be impact entrepreneurs today, what is impact entrepreneurship? Is it like charity? Is it running on grants, or what's the whole concept behind impact investing?
No, so impact investing is not grant or charity based investment business model. You are doing a for-profit social enterprise, but your target audience typically happens to be an underserved population. That underserved population might be underserved because of whether they're BOP, bottom of the pyramid, or they might be low income, or they might have a religious, because of religion or ethnicity or whatever it might be, right? There's certain factor which makes that population underserved. That's number one. Then the impact investor is measuring it not just on regular commercial metrics like your revenue and unit economics or so on. They're also measuring you on the impact metrics. So, for example, in our case, it's not enough to just do consults. We actually have to prove, are those consults resulting in some measurable health outcomes, right? So, for example, in our case, we have reduced in different interventions primary care costs by 50%. We have improved malnutrition by 15%, up to 15% in different groups. We have improved vision issues by 25% in different groups, and so on and so forth. So, is those impact metrics which we have to measure, which we have to then report also as part of the business model. And that's what the impact investor is typically looking at. Then it may be a convertible note, it may be a preferred equity investment. It might also be recently more of impact bonds happening, where it might be a debt instrument, but then there is an impact metric tied to it. And so if you deliver on that impact metric, then your interest rate might be waived off or something like that.
Oh, very interesting. And I think that's a very important point you just made, that impact investing does assume that you will return the money back, right? They may not take a bet on the return, but they definitely expect the principal back, if not any return at all. So I think it's a very interesting thing called the impact bond. I'm going to read up on that. So right now, I think Sevamob is available, obviously, in multiple cities, 15 states in India. How many countries are you available in?
Currently, 2 countries directly. So in India and then in the US, in the state of Georgia, and then we have done pilots through franchisee in Southern Africa, primarily South Africa. We also have a franchisee for Central America, but we've not done any deployments in Central America yet. We do have coverage in Botswana, Lesotho, and South Africa.
And so now I want to talk a little bit about your fundraising activity that you've had so far. I think you raised your first round from, like you said, Village Cap investments, right? Village Cap. And what was your pitch, right, to such an investor? Like, it was very early. It's 2012 is when you raised the money. And you were talking about sitting in Georgia and building all this technology and servicing all these millions of people in India. And 2012, mind you, India did not even have 50 million internet subscribers. We have 730 million today. But at that time, like, what was your pitch? What were you telling these Village Cap guys that they invested?
So Village Capital has a very interesting model, which is based upon peer investing, and so they select a cohort. The cohort has around 10 to 15 companies in it, and then the companies vote each week on which company should receive the investment. Right at the end of it, they make investment to two of the companies from that cohort. So that's how we got an initial $50,000, where we had to convince our peers that we were an investable business, and the business made sense, and the business could deliver impact.
Very interesting. Wow.
And our next round was led by ADAP Capital. We have been very blessed so far that our investors have been very aligned with Sevamob and our roadmap, and so far what we have done. Some of the other investors, entrepreneurs, have not been so, I would say, lucky or fortunate as we have been. So that round included ADAP Capital, Impact Assets, and Rianta Capital. And then we did another round in October 2015, and that round was led by HNI called Scott Satterwhite out of Georgia, and other participants were Impact Assets. Then our last round was led by AI Coin, and other participants were Sorensen Impact, and also one HNI. So all of these have been very aligned with our roadmap and very aligned with our business model, and they've been very instrumental in giving us the right connections, because getting investment is not just about the dollars. It's actually also about the network that they introduce us to. And so we've been very lucky so far. All of our investors have been very aligned that way with us.
It's very interesting. You got money from AI Coin, known for obviously making a lot of AI investments. Is actually a commercial investor, not really an impact investor. But I also read a comment where you said a technology only solution isn't going to get us anywhere. What did you mean by that?
In a developing country, technology only does not solve any pain point. You typically have to look at the complete solution. So even if you look at guys like Flipkart, it's not like they just, as they built out their platform, it's not that they just okay, here's a cool website where you could order products. They had to figure out the distribution. They had to figure out the delivery and post everything, right? So in the same way, somebody like us in the healthcare space, if we just provide a technology is dime a dozen in the healthcare space. What we have to provide is an actual health outcome at the end of the day. If we cannot deliver that health outcome or any type of outcome to a typical customer, and who their payer is or who our product sponsor is, it's not going to go anywhere. We can have all the best technology that we can.
So, I mean, I am very strong believer that technology first approaches don't actually guarantee any kind of success. I mean, I'm on the same page there. But I think technology is also a very strong enabler, right? If you have a strong business case, technology can actually accelerate where you want to get. And so therefore you have to have that understanding that, I mean, unless you're like a really deep tech business, and usually very difficult, at least in India, to fund, because we're not patient enough investors. We don't have 15-year funds that can just stay invested. But usually what I've seen is that, you require a different kind of a DNA when you try to be just a deep tech kind of an investor, right? And is that what you're expecting AI Coin to be for you guys now?
Yes,
We've
and
heard.
shortly we expect to close like on our next funding round. And so, yes, luckily these investors, they have the same thinking as you have, Anirudh, that technology alone is not enough. It has to be do a solid technology competitive advantage, right? Because without a tech advantage, just a regular services business is very hard to scale, and it does not go anywhere. But with the tech, like you can scale it much faster. You have some other competitive moat and so on. So I would say that's how it is done. I'll just take one use case. So let's say you have a telehealth only company in India. Somebody calls you and says that they have fever. Now, a fever can be for 50 different reasons. What is the first thing that you do? You cannot write a prescription. You might say, okay, you take Crocin for like 2 days, but you have to send that person somewhere, patient somewhere for diagnostics, right? And so it becomes a lead-in then for diagnostics. And so you have to have then partners or somebody else do it for you, or you have to build your own stuff. So especially in the healthcare space, technology alone would never solve the problem. You have to have a hybrid model, and that's where my big feedback would be to anybody on this call who's looking at healthcare models.
How does this Ayushman Bharat scheme, does it really help, or does it actually become a competition now that most of your rural Indian population can go to a hospital and not worry about paying for any treatment up to 5 lakhs? Does that become like an impediment, or is that a complementary for you, for what you guys are doing?
So for us, it's complementary because as an entrepreneur, you have to choose your sweet spot, right? A lot of that Ayushman Bharat payments is for secondary care. And we deliberately decided to focus on primary care, whether that is from a technology perspective or from the health outcome delivery perspective, right? So there is no direct competition there. And then because of that, we all automatically have somewhere where we can refer the patient to, even if it is a BOP patient, right? They still have that cushion of 5 lakhs. Prior to that Ayushman Bharat 5 lakhs, there was already a government scheme. And the only thing was, instead of 5 lakhs, that RGBSI policy had a cover of 1 lakh to 2 lakhs. Right, and you could go still. So the government rebranded that scheme, increased the cushion or the coverage on that to 5 lakhs, and many more hospitals are accepting that now. So I would say that has been very complementary to us because our focus is primary healthcare only.
Very, very interesting, Shelley. It's been an amazing conversation, and I think I just have so many questions that's back to back that are coming up. But we're running almost towards the end of our time. So I have a couple of questions, maybe more future or crystal gazing at this point. Like, where do you see Sevamob in the next 5 years?
In the next 5 years will be a technology-led business, which is operational in multiple developing as well as developed markets across the world. And the pain point, the focus though would always be solving this problem of primary healthcare and transforming that a solution for that for underserved populations, whether that is in developed or developing markets.
And do you see yourself expanding in, obviously Africa is a market you're looking at, but do you see yourself getting into maybe the South American or the East Asian or the Southeast Asian kind of markets as well?
Yeah, so South Asia, Sub-Saharan Africa, Central America, and even developed markets like the US are markets of interest to us at this point.
Wonderful. So I think what I'm going to do, Shelley, is that we've got just enough time to probably do our rapid fire. So I'm going to end the conversation here for now. If anybody has any questions, please feel free to ask them in the comment section, and I'll take them at the end of the rapid fire. Shelley, I'll explain the rules of the rapid fire very quickly. I think rapid fire is like I said, we're going to shoot out about 10 questions to you back to back. Whatever first comes to mind, you just need to answer it. This is the only part of the conversation I've not had with you in the multiple lead-up conversations to today. So are you ready for the 10 questions?
Sure, let's do it.
Okay, great. First question is a Peter Thiel question. One thing that you know to be true, but very few people agree with you on it.
Very few people think that we can become a very big company with, let's say, PayPal type scale and model. But I think that we can do that with the right support from the right partners.
What is the support that you would say is required for you to become a PayPal style large company?
Both the funding at a scale where we can grow that business to that scale, and the second and most importantly, the strategic partnerships which can take us there.
And anything specific you're looking for in a strategic partnership?
So typically, when we deploy in a new area, we're looking for local partners who have either access to business development or access to accounts or access to some sources through which our platform can be deployed more quickly in that area. So I would say those type of partnerships, whether those are systemic partnerships with guys like Path and Care, or right. So those are the ones which would be very instrumental in us getting us to the next level.
Who's your favorite superhero and why?
That's a tough question. I don't know, man. I'm not a big.
I do what?
I'm not a big comic.
Marvel?
Yeah, I'm not a big comic hero guy. But initially, I used to. When I was a kid, I used to do a lot of Chata Chaudhary and Phantom comics and so on. But I don't have any favorite heroes.
One piece of advice to founders about fundraising, and it's going to be very interesting from your side because you have a very tough fundraising ecosystem, right? It's not a very huge ecosystem.
Yeah. So one advice is everybody wants to do good. A lot of our my peers, they want to do good. It is very hard to raise funds if you are totally impact business. You have to have a viable business model. So think from day one about a viable commercial business model, and then the impact would automatically flow from there.
Usually, are you a morning person or a night person?
Morning.
And let's see. What is your typical morning routine like?
Get up around 5 a.m. I do a morning run of 3 to 4 miles. That is very helpful. Do some weights after that, and then I start with my first set of meetings after that, after a short meditation.
And what's the last thing you do before you go to sleep?
Just talk to my team in India. Also watch some clips on YouTube, and read. I read a lot, and I am a speed reader. So.
And according to you, what is one thing investors should bring to the table other than money?
For each round of investment, the best thing which the investor can do is if they have some contacts lined up for the next round of investment, or for a potential exit if the company is not able to deliver on the milestones. And I would say, just going back to the Village Capital example, that was the best thing they did to us. So when they did the seed, they already had relationship with our next round lead ADAP Capital. And so they got their redemption and we got the next round of investment, and then we were able to grow the business. So anybody who's thinking about investing, please think about it from that perspective.
And it's very interesting, the point you just brought up, but could you elaborate a little bit more on that?
Sure. So something which differentiates the commercial space with the impact space, or with the US market, with the Indian market, is there are a lot of exit options in the US market, right? If say the company is not growing as fast, the exit option is that the company gets acquired by somebody else from somebody's investment portfolio, right? Or let's say the investor A, at the next round, they already have investor B lined up. So the investor B then gives them redemption, and they get their exit, right? So the money stays in rotation for the investor, right?
Makes sense.
That is, I think, missing. And you probably know this better than I do and understand this better. In India, that is missing, and especially in the impact space, right? For the early stage impact investor, it is the very limited options for when the next round exit, and how it would happen, right? And same way for the company itself, and there are very limited options for who might buy them and when, especially in the impact space, right? So that reduces the money in the ecosystem overall, if you cannot show the number of successes at different levels.
I mean, I think that scenario is changing in India. I think we're getting more comfortable with M&As, but yeah, I would still say that India is also a very competitive market. There's no space for number 3, 4, 5 in India. It's all about number 1 or 2, right? And if you're not number 1 or 2, then you're nobody, right, in a category. And I think that's also while obviously it's the survival of the fittest kind of a scenario, but it also becomes extremely competitive. And there's no space for 3, 4, 5 in India. I mean, they can survive, but they're never going to get recall and premium valuation. So yeah, it is a very difficult deal. I mean, I think it sort of also bleeds into my next question, that what one thing you would like to change about the Indian startup ecosystem, because you're part of both, so you can obviously see both. So what's one thing you would like to change about the Indian startup ecosystem?
The biggest thing would be, and especially just to refer back to your previous question, you said the M&A is increasing in India. Yes, but in the commercial space, right? In the impact space, I mean, the number of options you have, like, you can count literally on your, like,
very true.
one finger, right?
I can see that.
Yeah. So regarding the Indian startup ecosystem, the number one thing is, if the government, for example, says that they are going to provide up to 2 CR of collateral-free loans, they need to make sure that the downstream funders who are actually making that loan are actually making that loan, and that is actually collateral-free, right? If they cannot ensure that, just setting up hopes, just like waste the cycles of like the startups. The second thing is we need more options in India. Now there are options, but we need more options for short-term working capital, right? Because a lot of different businesses, whether commercial or impact, if we can just solve that short-term working capital problem for them, they might not even need as much equity, capital, right? And the entrepreneurs might retain more control in their business if they can figure out that short-term working capital option. Oftentimes, they are using the capital for the wrong reason. They might use equity for doing that short-term working capital, and that just that's harmful for everybody.
It's criminal. It's criminal waste of capital. If you're using venture capital to fund your working capital needs, it's a criminal waste of your capital.
Yep.
No, completely agree with that. I think that's a very profound, very important point, and I think we should definitely, definitely needs to be brought up, right? That the government scheme of this, it's called the CGT SME scheme, right? And it's very few companies, at least in my portfolio, and I have 85 companies in the portfolio. I would probably be able to count on one hand the number of companies who have actually got that money, right? And the kind of hoops they had to go through to actually get that money, right?
And imagine, Andrew, you are investing in the very good businesses, right? You're investing the best of the best. So think about all the rest of the SMEs, right? Think about where they are.
So true. There are many problems to solve, but I think I completely agree with you that on one more point here that, unfortunately, because of the lack of debt options in India. So when I started in the US, much like yourself, it took me like 24 hours to register a business name. It took me another 24 hours to get the bank account. And it took me another 24 hours from there for the bank to call me and actually offer me an overdraft facility. And I'm talking about in 2009. I started in 2009. I got $150,000 line of credit with I think I was a Bank of America at the time, and this is the bank calling me in the middle of a crisis, right? And even till date in India, I do not have an unsecured credit card. I don't have an unsecured credit card for corporate purposes, and the government definitely needs to solve this. I think it is. I can't even tell you how difficult it is for founders to actually run businesses when we cannot use, when we don't have any kind of a debt requirement. We can't use credit card. We're being forced to use debit cards on corporate accounts, which is again, it's just fraught with problems, because there could be lakhs of rupees or crores of rupees in the current account, and you're using a debit card somewhere. Something could happen, and I'm just surprised that the government hasn't done anything. And while they might be pushing it, the banks have just pushed back. So this is definitely a space ripe for.
And another example, which is a more recent example, is of COVID assistance, right? You know how many MSMEs have been impacted by COVID, like negatively impacted by COVID, right? In the US, it took the government 3 months from start to of the program to actual deployment of the program to help the small businesses, right? We got 2 months of working capital initially as loan, and then later the loan was waived off and became a grant, right? In India, I do not know of any similar schemes for the SME sector, right? There's been a lot of talk, but I don't know of any such actual schemes. There has been a lot of direct payments to, let's say, the BOP consumers, right? There have been a lot of direct payments to other set of consumers. But guess what? A lot of these migrants who have lost their jobs or stuff, if we can just provide some type of support to the SMEs, all of a sudden those migrants will get their jobs back, or part of the jobs back, or part of the income back, and then rest of the market would build up accordingly along with it.
Yeah, I think getting them back to work is going to be definitely the problem worth solving. Yeah. I think I'm going to ask you 2 last questions, and I've got a couple of questions from the audience. Let's see, if you could pick the brain of one person for 24 hours and ask them anything you wanted, who would it be?
I would definitely say it would be somebody in India who has scaled the business like Infosys, because scaling the business in a developing market is very different from scaling the business in a developed market. And so just picking their brains on how they initially funded the company, on how they scaled, how they got the contracts, how they made it happen, that would be definitely very useful.
Is there any one person you have in mind right away, like the first as a name pops
Not
into
off
your
the top
mind?
of my head, but yeah, not off the top of my head, no.
Okay. And what book? What are 3 books you would recommend to founders?
Oh boy.
Every founder should read these 3 books.
I do not know, but I would say I have done a lot of reading recently on genomics and AI applicability in genomics, because I think that's going to solve a lot of problems going forward. So if you are let's say entrepreneur in the healthcare space, you should definitely check out the books in that space. They include deep learning for drug discovery, genomics, and diagnostics, and several other books of similar nature.
And I think I'm going to ask you a last question. Which company do you admire globally? And you can't say Tesla.
That's a special category. I would say companies which have been able to solve, for example, a company like Uber or Ola, right? A very regular commercial business model, but think about the number of people who have gotten jobs or regular monthly incomes, full-time or part-time as a result of that. So they didn't start as impact business, but guess what? They have had one of the largest impacts in the last 5 years.
Great. I think I'll ask you the one last question because we run out of time, Shelley. But the question I have is from Deep Desai Deep. It's his question is how should an entrepreneur find angel investors?
It involves hard work, but I would say definitely if say you are in India, and it depends again on which space you are targeting, right? For me, impact space is what I'm familiar with from angel perspective. So I would say go to a lot of events like Sankalp and events like that. There are a lot of angel investors who come to those type of events, and also just if you have developed something, put your name out there. Do more of these type of podcasts or these type of white papers, so that your name gets out there and you can use as proof points with angel investors. Separately, if say you are in US or other places, there are guys like Fundable, and there's also an option in the US to do crowdfunding, and it is very easy to set up your campaigns on those type of platforms. I do not know, Anirudh, I don't know if it's coming up or it's already there in India or not. But in the
you've
US,
got Angel List, you've got Let's Venture in India already.
Yeah, but doing a RedCF campaign or doing similar campaigns in the US market is very easy, and getting to the angels through those campaigns, it's very easy.
So that in India, although I think we're not there yet because there is a bit of a concern about marketing companies online. I think, but again, you can go to a Let's Venture or a Angel List, and you can crowdsource investors from those kind of platforms. But that being said, thank you so much, Shelley. This has been a great conversation. Like I said, the first conversation where I have a cross-border entrepreneur, someone sitting in the US, and actually someone who's been through something very few of us have, which is starting a company in the US, running that, and then coming to India and then starting a company here. But I think you've taken it one step beyond, because you've started an impact venture in India, and that too in rural healthcare. So it's definitely hats off to you. I really wish you the best of luck, the best of I just want all your hard work to pay off. Is all I could say. So thank you very much for your time, Shelley. Any final thoughts?
Thanks for having me on the show. No, thanks for having me on this show, and good luck to all the entrepreneurs who were on this, watching this episode.
Thank you so much. Thank you, everybody. See you guys next week on episode 32.